Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be focusing on the chronic gastritis. And let's focus on the types of the chronic gastritis. So the chronic gastritis is divided into two types. One is the type B and another one is the type A. So let's look at what happens in the type B. So this type B is present in majority cases, that is about 90% of the cases is type B. So what will be the site of this? The site is going to be the antral is the very predominant. So antral is predominant. Next is what about the acid production? Acid production will be normal or it can be increased. So what about gastrin? Gastrin is going to be normal or it is again going to be increased. Next, talking about the HLA, there is no association of the HLA with respect to the type B. So why are we discussing type B first is because it is the most common. So HLA, there is no association. Next, moving on to the S, that is the serology, it is nothing but the antibodies. Serology, it is nothing but the antibodies. And this is antibodies to the H. pylori. Next, moving on to the cytokines. The cytokines involved cytokines. The cytokines here involved include the IL-1 as well as the IL-8. They are the two ones which are involved. Then looking at what will be the long-term sequel. The long-term sequel. The long-term sequel is there is a non-atrophic pan-gastritis. So there is a non-atrophic pan-gastritis. So non-atrophic pan-gastritis is nothing but, it is known as a maltoma. So it is nothing but the maltoma. Then moving on. What about the other features? It includes peptic ulcers. So long sequel, there's peptic ulcers, as well as the atrophic pan-gastritis, that is the atrophic pan-gastritis, that's adenocarcinoma. Next, on the histology. On histology, there is the intraepithelial neutrophils, the intraepithelial neutrophils. So on histology, there is intraepithelial neutrophils. Second one is the subepithelial plasma cells. So subepithelial plasma cells. So two things are covered. Next, moving on to the other associated lesions. So it will be the other associated lesions. The other associated lesions, it includes the hypoplastic as well as the inflammatory polyps. So hypoplastic as well as it also includes the inflammatory polyps. Now let's talk about the associations. So association is there is a low socioeconomic status. So we write it as low SES, that is socioeconomic status, as well as that is nothing but implies the poverty and the residence in case of the rural areas. So all implying the same. Next we move on to the type A. The type B was most common with 90%, so the remaining 10% is going to be the type A. And the type A is going to be, it is autoimmune, A for autoimmune. A for the autoimmune disease. Next, let's talk about the site. The site here is going to be the fundus. A is going to be fundus and also the body. Whereas B included the antral, that is very predominant, and here it is going to be the fundus in the body. And another thing to notice, the antral sparing is seen. So what about the acid production? The acid production is going to be decreased. So in type A, there is decrease in the acid production. So the most common type B, is that it is going to be normal or it is going to be increased. Here it is going to be a decrease in the acid production. So decrease in acid production is known as the achlorhydria. Next is we move on to the gastrin. So what's happening in terms of the gastrin? So here in terms of gastrin, there will be increased in the gastrin is increased. So this term is known as the hypergastrinemia. Hypergastrinemia. And next we also have the HLA. So what happens in the HLA? HLA in type B there was no association. In type A is going to be association, and this is going to include the HLA DR3. So there's HLA DR3 as well as the HLA B8. Then moving on to the serology. Serology, it is going to be sensitive. Serology, it is going to be sensitive. So sensitive will be the anti-parietal antibodies. So it is going to be the anti-parietal antibodies, and specific is going to be the anti-IF antibodies. Anti-IF antibodies. Next is, what about the cytokines which are involved? In type A, there was the HLA associations, but there is no cytokine associations. No cytokine associations. Now let's look at the long-term sequel of, and this is going to be of the type A. So long-term sequel of type A, this includes the diffuse atrophy. So there is going to be the diffuse atrophy. Next will be the pernicious anemia. Then comes the adenocarcinoma. Then comes the gastric carcinoid tumors. Gastric carcinoid tumors. Now talking about the histology, and this will be about the type A. The type A histology is that it includes the lymphocytes, it includes the plasma cells, it includes the macrophages. Now what are the other associated lesions with this? The other associated lesions is it includes the neuroendocrine. So it includes the neuroendocrine hyperplasia. Next is, let's look at the associations. Under associations, there are some autoimmune diseases. So AI diseases. So this is nothing but autoimmune diseases, and this includes the thyroiditis. Next, it also includes the diabetes mellitus as well as the Graves' disease. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.